Good afternoon, and thank you for joining us today. We'd like to take this opportunity to answer some of the questions that was raised yesterday, as well as some updates in terms of our investigation that we were doing for over the weekend with high number of cases in our community. We are now at a point to call an outbreak at the University of Windsor residence that is linked to a Halloween party. We now have 5 confirmed cases that resulted from that event. 18 individuals are currently tied to that event, and 5 of these 18 are now confirmed cases of COVID-19. The index case came from, had a visit outside of Windsor-Essex and then attended the party while having some mild symptoms, and other individuals are now quarantining at this time as they are monitoring their symptoms as we speak. The University of Windsor has taken all the steps to clean the facility, ensure that all of these residents and students are isolating separately, and are taking all the precautions as in moving forward ongoing to prevent any further spread of the disease. All of the cases are between the 18 years of age, and the earliest onset of the symptom was linked to November 6th. Currently, there are no cases that are hospitalized, and there are no deaths that have been reported this far. On the same note, we're also reporting a cluster of cases that has resulted from the nursing students who happened to got together, and this is not linked to this particular event, but this is another cluster that we have seen in the community, and we know there's a lot of conversation happening in the media about these students. What we have deemed is most of these students, they are connected to this event and having get together on that particular day, but they also have contacts outside of those dates as well, because they are all students and doing their different work together. We have not identified any specific risk to the hospital setting at this time based on their placement, with the understanding that these students are following all the appropriate IPAC measures and using all the masks and all of the gowns and all the personal protective equipment as they should. So we just wanted to provide that update so the community is aware, everyone is aware with what's happening with these cases at this time. We'll be happy to answer any questions or concerns from the media and answer anything else.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AMA 100.
Dr. Ahmed, can you tell us, and I'm not sure if you can, what residence building this occurred in at the university?
We have to get that information from the university. I do have that information, but I think it would be appropriate if it comes from them. And it is my understanding that the University of Windsor is also sending a news release at this time. But what I can assure you and the community is that they have taken all the steps necessary to contain it and to prevent any ongoing spread. So everything is contained. The students are isolating independently in separate room to prevent any further spread of the disease.
To that point, are you concerned that, who knows, maybe an individual that lives in another residence or even outside the residence, they attended this get-together and that could spread to another residence on campus?
We don't have any evidence at this time, because I think the university is doing a good job in terms of keeping track of who's going where. They have a lot of good practices in place without getting into the details of it. So they can track down who is where and who is living in which of these residences. The only thing that I think through this calling it an outbreak linked with that specific event is to even identify if someone happened to be here and missed all these protocols and precautions. If they are there, we would request them to contact our staff at the earliest if there was any connection or any connection with the event whatsoever. Other than that, we are not necessarily concerned, based on the information that we have, that there is anyone else or any other residences can be impacted by it.
So I sorry, one more quick one here. I just want clarification. So an outbreak is considered at the university, and when it comes to the nursing students, that's being classified as a cluster?
Yes, so this particular outbreak that we are talking about, and I just want to be careful in terms of the language as well, that we're not calling it an outbreak at the university. We're calling it the outbreak at the University of Windsor residence. And the distinction is because technically those residences are their home, and these students live there. And even though that they are monitored and managed by the university facility, but not necessarily with the university. So that's one. And then the nursing student that we're talking about, the nursing students are not tied to this outbreak. These we're classifying it as a separate cluster. And in any other case, we may not even be reporting it back as a cluster per se, but knowing that the word is already out there in the media, and everyone is concerned about those individuals. But what I can tell you is these individuals, they are students, they live together, they interact with each other, and they had a gathering, not necessarily a party, and which resulted in the transmission between that group. And we are working closely with the university to make sure that if there's anyone else who is identified as a contact, we can connect with them. But those are two separate events. The nursing student is a cluster, which is completely separate. This, what we are calling, is an outbreak. This is a separate one, and this does not include the same students.
Okay, thank you.
Any questions from CBC?
Yes, hi, Dr. Ahmed. Given the nursing students, do we know how they contracted the virus? I know from an earlier press release it said that it wasn't from the hospital, so was it just community transmission for them?
I'll let Teresa answer that question.
We're still investigating the acquisition for the nursing students, but we do not know where they contracted the COVID virus.
Okay, and so there was 4 students from Windsor and 1 from St. Clair College, so all 5 of those lived together.
I think the University of Windsor were the 4 students who were there. The St. Clair one is a separate one.
Okay. And so these 2 separate events that have been looked at, are those the only 2 events that the health unit has been assessing, or were there other gatherings or Halloween parties that are being looked at as well?
So as of now, these are just the 2 events that we are monitoring, but given what we are hearing, and even from what we've anticipated, that there were many other parties that happened, and hopefully that there was not many transmission happened in those parties. That's the hope. But we are not aware of any other event that we are tracking at this time. So these are just the 2 separate incidents that we are trying to put together because of the number of cases that are linked with those events. Other than that, there's not any other events that we are tracking at this time.
Okay, thank you.
Any questions from Blackburn?
No, they've all been asked and answered. Thank you.
Okay. Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Separately to what you're speaking about today, I've noticed 2 confirmed cases among students at Bellwood Public School. Are those 2 students members of the same household, or is there an outbreak being declared there?
So there's no outbreak at Bellwood. We do have cases, and they are in the same household. So we do have students cohorts released, but no outbreak at the school.
Okay, thank you.
Any further questions from Amy Hundred?
Dr. Ahmed, just to follow up my question yesterday, I know you and your team have a lot on your plate, but by any chance did you figure out for the bars and restaurants what the proper steps and closing time is?
So that's a good question, Rob. We did had the chance to look at the regulations, and again, there's a lot of information in that regulation. But we are able to answer your question. Your interpretation is correct at this time, that because the province has put us in the green category at right now, and under the green category, they can stay open late as per your question and some of the businesses that are asking those questions. We are looking into our local situation very carefully, and we are looking into how we can keep our community safe. But as of today, we're following what the provincial guidelines are, and that's what we are hoping that people still need to understand, that COVID is not gone away. It still exists in the community. Loosening some of these restrictions doesn't necessarily mean that the risk is low or risk has gone completely. So please, do not misunderstand these loosening measure with the low risk probability. The risk continues to be medium for our community, and it can change very quickly. We reported 6 cases today. That's a good sign, but it can change very quickly. We know that. We have seen that. So as much as I want to support all our businesses in the region, but it is very, very important for these businesses as well to make sure that they are taking all the appropriate precautions to keep their patrons safe, keeping their employees safe. Any incidents or any loosening of these measures can result in disease transmission, which could be very detrimental for our community and for our business community in particular. So please do not equate loosening of these restrictions as a mean to understand that the risk is low in our community. It's not. It's a medium risk. It's still. So we have to be mindful of everything we are doing and take all the right precautions.
If the province keeps us at green and our numbers keep on increasing, could yourself and the local health unit put an order in place going back to the 11 p.m. last call and 12 a.m. closing? Is that an option if our numbers increase and the province keeps us at green?
Yeah, that's definitely an option available, but what we are trying to work with all our municipalities and our partners to have their understanding and their perspective addressed to. We don't want it to be a decision coming directly from the health unit unless it's absolutely critical. We want it to be a collaborative approach. We want the province to be on board. We want the municipalities to be on board in keeping our community safe. It's everyone's responsibility. It's not just me who will keep our community safe. I think our leadership, our municipalities are equally responsible for everything that is happening in the community, and we need to work together to make sure that we are keeping our community safe. We're keeping our businesses open, and we are doing everything from our expertise and our role to keep our community safe. And we like to see it a joint initiative or a joint effort rather than just me using the any kind of section order to guide these businesses in the region.
Thanks, Doctor. But I know we're not speaking until Friday again, so I have one more quick question for Teresa. Teresa, obviously with the university cases, the schools, the businesses, I guess, I know it's been busy since day one for you and your team, but I guess right now, is it straining resources even more because there's so many different avenues?
So we had a really busy weekend, as you know, because with any of the cases in the schools, we have to look at the cohorts that have to be dismissed. So we are working with the elementary and high schools as well as the university and college. So it has been busy the last few days, and we are looking at our resources and also the scheduling. So we do have staff that are working, a smaller amount of staff working on the weekends and holidays, and tomorrow, Remembrance Day, is a stat holiday for our health unit, so we will be working with a smaller group of case managers. But we are looking at everything, and we have done a lot of planning before these surges, but as new staff come on board, we're spending time onboarding staff as well. So wanting to make sure they have all the information they can to comfortably assess the surge in cases. But we seem to be not really having too much of a downtime through this pandemic. We're addressing things on a daily basis. In addition, we have some other, as you said, other things going on in the community as well.
Thank you. Have a great rest of the week.
So Rob, before you leave, I just wanted to come back to your earlier question, and I think in addition to us being in green and some of these restriction or loosening of the restriction, however you want to call it, I want to emphasize that still based on what we are seeing, our biggest risk is the social gatherings. So we have to pay attention to that, even though we know, these businesses, they need to stay open. We get it. We understand the economic side of it. That's fine. But and maybe many of these businesses are taking all those precautions. They are doing everything to keep everyone safe. And but the concern is about these social gatherings, because these social gatherings are happening more frequently. And we want to make sure that people who are organizing those events, first of all, there's a cap, there's a limitation on how many people can gather in these in your social gathering. And secondly, these social gatherings can be much of a bigger risk compared to even when you're going out dining or doing anything else. So I think people should not think that social gatherings are a benign or a low risk event. And as we have talked about many times, what you're considering as your social bubble are the people that you are meeting. Your social circle or the people who are meeting other people is probably much a higher number. So key message I want to leave today is these social gatherings, we need to pay more attention to those gatherings, because those are unmonitored. People are much more relaxed in those type of gatherings and are not taking any precautions, which would continue to lead to more cases. So as a community, I think we should all be responsible and we should follow all those guidelines. So I just wanted to make sure that I say that for our community risk perspective where we are.
Thank you.
Any further questions from CBC?
Yes, the 18 individuals that are tied to this Halloween party in the residence, is that the total number of people that attended the event?
Yes, that's what we are aware of. And out of these 18, 5 of them are currently positive.
Okay, so of the 18, 5 are positive, and then the others, which I think would be 13 if I'm doing that math right, are isolating.
That is correct, yes.
Okay, and they all are from the same residence?
To our knowledge, yes.
Okay, and then just another question here. Just yesterday, as I had mentioned, looking at that pandemic status, what are you looking towards if you do decide to move us up a level in our pandemic status? So go us into that red color. What is being looked at specifically to make that decision right now?
So when we are looking at these decisions or local recommendations, I think the key is to see where these cases are and how they're spreading, and what are the tools that we have to prevent those spread. And I know, many of these regions in the province are also considering using some of these additional measures or restrictions to keep their communities safe. Peel, for an example, their MOH has issued an instruction under the Regulation 264, I believe, and to cancel some of these things that are already happening in the community, including social gatherings. And the effectiveness of that, the utility of that, and the enforcement part of that, I think those are all the things that we would like to see. We want to make sure that we're making a decision that is reflective of what is happening in the community and the ability for our community to enforce many of those things. So we will be looking very closely at what are some of those tools and what are some of the things that we can do. And as I mentioned, right now, our cases are scattered into so many different areas, which is obviously pointing out to the fact that people are not following some of those precautions. And we should be taking that seriously. It's not the time to think that because we are in green, the risk is gone. It's not gone. And I think I cannot say it more. Maybe the risk of spread is even higher every time when you're loosening any of those restrictions. So please pay attention to what you are doing right now and how you can keep yourself safe and keep everyone safe. But we will want to work with all our community partners to provide some specifics if needed. But our focus is to make sure that the cases, wherever they're coming from, and if there's any specific actions that we can attach to it to prevent it from happening in the future.
Okay, and then just another kind of clarification question. The nursing students, that wasn't a party, but they did have some sort of gathering.
Yeah, so they did had that gathering, but it may not necessarily be entirely different than, students attending university. And if they know each other, as student ourselves, we like to find opportunities to sit together and do something. And, in these type of events, if it was an occasion to celebrate something, people do that. So it's not uncommon for them to do it. I think the only question that I would say is we just need to be more responsible and monitoring ourselves, especially if we're even feeling any kind of mild symptoms or if any concerns about high risk exposure. Most of these students, they don't necessarily live in Windsor-Essex, so they may be traveling to some other places where there may be a higher community transmission. So one of the message is for anyone who is going back to a high transmission area such as Toronto or Ottawa or some other places, Montreal, where there's a high level of community transmission happening. When you're coming back from them, please pay more attention. I think that's a critical piece. We are not calling in for quarantining them at all at this time, but at least just be responsible. If you you went back to your home in a high transmission zone, when you are coming back, take precautions, monitor your symptoms, and isolate yourself immediately if you develop any of those symptoms.
Okay, so maybe one of these students traveled to a high-risk area and then came back to a household with 3 others, and that's kind of how it happened?
I think that's the common trend that we're finding. I don't remember specifically about these 4 students, but that could be the case, yeah.
Okay, thank you.
Any further questions from Blackburn?
No, thanks.
Windsor Star?
Yes, I'm not sure if this was addressed yesterday, but who is responsible for bringing food and other necessities to the students who are self-isolating in their residence?
So the university has a plan, and it's a plan for a COVID response, and they actually have followed it very well. So they are isolating the students in separate quarters, and they're arranging all of their needs for them, so food included.
Okay, thank you.
Thank you, everyone.
Thank you.